Concerns about COVID-19 didn't stop millions of Americans from celebrating the unofficial start of the summer. People packed beaches across the country over Memorial Day weekend, even as the deadly disease claimed at least 2,000 more lives. For more on this, let's bring in New York pediatrician Dr. Dyan Hes. So, doctor, we saw people on social media putting some social distancing measures over the holiday weekend, but we saw a lot of videos also of people not doing that. We saw people in pools and on beaches, and I just wonder what kind of impact that could have in the coming weeks. Could we potentially start to see levels of infections rising in some of those locations?
Oh, I think for sure. I think only time will tell, and I think this is what physicians and scientists have been waiting for. It's for some reason the communities are not trusting their medical professionals about social distancing, and they're testing boundaries. And when these communities start getting sick, like the teenagers who were our college break students who all got sick in Florida, like then they went on social media and said, "Oh, I'm sorry, I was like drunk on a beach with hundreds of other people. Now I have COVID." Is that what it's going to take for these states to realize social distancing rules are in place for a reason? I have to say that I feel like in New York City, because we've seen the brunt of it, people are taking it. I mean, not everybody, but I went out yesterday. I did errands. We went to Walmart. Every single person was wearing a mask. Everybody was so respectful. They were sanitizing the carts. And I think that these states that haven't seen the magnitude of COVID are just in denial, and it's going to hit them.
Yeah, Vlad was talking about, people going to pools, and there was that big pool party in the Ozarks, and that's, you can see the picture everywhere. And in Missouri, they've asked those people to self-quarantine. And it occurred to me, we've talked a lot about the importance of contact tracing, and how when an event like this happens, the fact that we don't have proper contact tracing implemented yet in this country can have dire results. Like, you look at that aerial shot of all those kids in the pool, and you're like, who's going to keep track of who showed up at this party and who's quarantining and who's not?
And who stopped to get beer on the way, who stopped at the deli on the way. I mean, there's so many people that they have come in contact with. They fueled, there is a reason that we are recommending these measures. I mean, I feel like unless it was at a national level, unless this is done at federal level, I should say, that this is never going to end, because every state is, doing something haphazardly.
Mm-hmm.
Doctor, it's interesting to me, in addition to all those people that we saw in the pool, there seems to still be a misunderstanding, at least as far as I can tell, when you see videos like that, where people say, when they speak to reporters, a lot of young people especially say, well, you know what, I'm young, I'm healthy, I think I could beat this if I ever get it. And what I fail to understand is why is it so hard for people to understand that these measures are in place, not always to protect yourself, although they are used for that. It's also to protect other people. I don't know how often it needs to be hammered home how asymptomatic people can infect people who are at risk. You've got the President of the United States who refuses to wear a mask a day after the Surgeon General of the United States, the top medical officer in this country, releases a public service announcement saying, as you go and enjoy your Memorial Day festivities, please wear a mask. The Surgeon General was wearing one. The President of the United States refuses to wear one for reasons that are still unclear to people. Can you just once again explain to the audience why the mask is important, not necessarily for yourself, but for others, and what 6 feet apart social distancing means when people can be asymptomatic and they sneeze in the vicinity of other people who have comorbidities?
So we know that the droplets can travel like 13, 14 feet in the air. So yes, President Trump might think he's the healthiest person on the earth, and I might think I'm very healthy. But when I go out, I wear that mask out of respect for you. So I'm wearing that mask. So if I do sneeze or I do cough, I don't spray all the people around me. And we all know that there are hundreds of thousands of probably people who are asymptomatic. I mean, when we're doing the testing now, we're seeing that many people, and look at all the kids who are getting this syndrome, the multi-inflammatory syndrome. Most of them didn't even know they had COVID. So there are tons of people who are asymptomatic. So we wear this because we respect other people who are going to go home and take care of their grandma, or who are going to go home and take care of their child with cancer. Listen, I talk about this till my face is blue about vaccines. What do you do with the anti-vaccine movement? It's the same thing. They say, I don't need the vaccine, I'm healthy. But we vaccinate everybody to protect, especially with MMR, to protect those people who would die if they got the measles or the mumps or rubella. Same kind of
So
scenario.
let's talk about this inflammatory syndrome that you just mentioned, because it sort of piggybacks on what both of you said, this idea that young people, won't get it as badly. Well, somehow that's not entirely true. And what we started to see in children is this inflammatory syndrome that looks very similar to Kawasaki disease. Yeah, the numbers aren't tremendous, but it's something we didn't know about COVID-19 before. And now we're seeing it not just in children, doctor, but also in younger people as well, or people older than children, younger adults older than children.
Very true. And also, so like in some practices, we see college age students. Like in my practice, we see kids till they're 24, really basically till they're young adults. But in many pediatric practices, they don't see young adults, and then they get discharged when they're 18. And these young adults, honestly, many of them don't even have a primary care doctor because they're very healthy. So they use urgent cares a lot. So they don't even have a medical home. And when you're sick like this, when you feel like you have fever for 4 or 5 days, you have red eyes, swollen glands, rash, abdominal pain, diarrhea, you need a medical home. You need somebody to contact to tell them, I am not doing well, or you should just go straight to the ER, because until proven otherwise, if you have this constellation of symptoms, this is, multi-inflammatory syndrome in children.
Before I say thank you, and I know they kind of want to wrap us up, but I want to ask you this. The weather is getting better. People do want to get out. And for some people, staying at home has been fine, but for others, it's been a tremendous strain, stress-wise. I just wonder if you have any sort of words of wisdom to people who are itching to make contact with others. Some people, they thrive when they are in the presence of other human beings, and this is really tough for them.
Especially children. That's what we do all day. I would say that if you want your children to socialize, they need to wear masks if they're with other children. If they're over age 2, they should be socially distanced. Maybe they can go to a playground or a beach and play next to each other in the sand, but not on top of each other. They need to wear masks, good hand washing, maybe go for a bike ride together with a mask on, go for a walk, socially distanced. But you can't have these parties. I mean, yesterday was Memorial Day, and my daughter went bike riding with a friend. They've been quarantining, sheltering in place together since this started. They came home so aggravated because they saw barbecues with tons of cars parked in front of people's homes. They're kids, and they said, we're doing it, and we're working so hard to stop this, and then the grown-ups aren't listening.
It's so true. Dr. Dyan Hes, thank you so much, doctor.
All right, take care, be safe.